If you're waking up multiple times every night to urinate, I need you to pay attention to this video. Because the problem might not be your prostate medication. It might be what you ate for dinner. 3 common foods have been shown in multiple studies to worsen BPH symptoms. One increases risk by 38% according to long-term research. I see this pattern constantly in my practice. Men eliminate these 3 foods and suddenly their symptoms improve without changing anything else. No new medications, no procedures, just dietary changes that work. I'm Dr. Max, urologist for 15 years specializing in prostate health. Today I'm revealing which 3 foods are sabotaging your treatment and exactly what to eat instead. But before I tell you which foods, you need to understand why diet affects your prostate this way. I want to give you something that can make a real difference starting today. I have created a complete guide for you, 5 simple steps to boost your sexual health. This is not theory. These are practical, science-backed actions you can implement immediately. Inside this guide, you will discover the exact protocols I use with my patients, how to optimize your testosterone naturally, what actually reduces stress and restores function, the specific foods and exercises that support hormonal balance and blood flow. Everything is clear, specific, and proven. Go to the link in the description right now and get your free checklist. Take action today. Your confidence and health are worth it. Most men have no idea about this connection. Here's what happens inside your prostate when you eat the wrong foods. 3 mechanisms get triggered. First, inflammation. Certain foods spike inflammatory markers in prostate tissue, making it swell. Second, hormone disruption. Your diet directly affects testosterone conversion to DHT, the hormone that enlarges your prostate. Third, metabolic syndrome. High insulin levels from poor diet choices create an internal environment where prostate cells multiply faster. A Harvard study followed over 30,000 men for years, tracking exactly this connection between diet and prostate growth. Half the men over 50 have an enlarged prostate. That's normal aging. But here's what matters. The rate of progression isn't random. Your daily food choices either slow it down or speed it up. So which foods trigger these 3 mechanisms the worst? Number 1 surprised even me when I saw the research. Number 3 is sugar and refined carbohydrates. White bread, pastries, breakfast cereals, sodas, processed snacks. A 2020 study on ultra-processed foods linked high sugar consumption directly to BPH progression. Here's why. When you consume sugar or refined carbs, blood glucose spikes rapidly. Your pancreas releases insulin to manage it. Chronic insulin elevation creates inflammation in prostate tissue and speeds up cell multiplication. I had a patient whose symptoms kept worsening. He told me he wasn't eating junk food, but his morning cereal contained 18 grams of sugar. His low-fat yogurt had another 15 grams. Energy drinks in the afternoon added more. We eliminated processed foods and switched to whole grains. For weeks later, his urgency improved noticeably. Occasional dessert isn't the issue. Daily consumption is. Now sugar makes sense to most guys. But the next food shocked my colleagues when research revealed its connection to prostate growth. Number 2 is high-fat dairy. Whole milk, cheese, butter, full-fat yogurt, ice cream. A 2015 meta-analysis found that men consuming high amounts of dairy fat had significantly elevated BPH risk. Here's why this surprised the medical community. For decades, we recommended dairy as healthy protein. But research revealed the problem isn't the dairy itself. It's the saturated fat. High saturated fat intake disrupts hormone metabolism. Specifically, it increases conversion of testosterone to DHT. DHT is the primary hormone that causes prostate enlargement. The more DHT in your system, the faster your prostate grows. Now here's what matters. Not all dairy is problematic. Low-fat options and fermented dairy like kefir don't show the same risk. A patient switched from whole milk and cheddar to low-fat alternatives. His PSA levels stabilized within 3 months. You don't have to eliminate dairy completely. Just choose wisely. But neither sugar nor dairy compared to what the largest study ever conducted revealed about food number 1. Number 1 is red meat and processed meat. The health professionals' follow-up study tracked over 30,000 men for years. Men who ate red meat daily had a 38% higher risk of BPH progression compared to men who ate it occasionally. That's the number in our title. Here's why red meat is so problematic. 3 mechanisms working simultaneously. First, heme iron creates oxidative stress in prostate tissue. Second, saturated fat disrupts hormone balance like dairy does. Third, compounds formed during high-temperature cooking trigger inflammation. Now processed meat is even worse. Bacon, sausage, deli meat contain nitrates and preservatives that amplify these effects. But here's what matters. I'm not telling you to become vegetarian. Frequency is the key. Daily consumption versus twice weekly makes the difference. One patient cut red meat to weekends only. His urgency symptoms improved within 6 weeks. So now you know the 3 foods. But here's the critical question. What should you actually eat instead? Focus on a Mediterranean-style approach. Fish rich in omega-3 fatty acids like salmon and sardines. Vegetables, especially tomatoes for lycopene. Olive oil as your primary fat. Nuts, particularly walnuts and almonds. Whole grains instead of refined carbs. Here's how to make this sustainable. Don't eliminate everything overnight. That never works. Start with one change. Reduce red meat to twice weekly maximum. That's phase 1. Phase 2, switch to low-fat dairy options. Phase 3, replace white bread and pastries with whole grain alternatives. Most men notice symptom improvement within 4 to 6 weeks of making these changes. Better flow, less nighttime urination, reduced urgency. Now here's what matters. These dietary changes work best when combined with something else. Something that addresses the root cause directly. Let me explain what I mean. Diet alone isn't enough for moderate to severe BPH. I see guys try to fix everything with food and supplements. That's not realistic. If you're waking up 4 times a night, diet helps, but you likely need medication or other intervention. Here's my approach with patients. Diet creates the foundation. It reduces inflammation and slows progression. But you need medical evaluation, PSA testing, digital rectal exam, urodynamic studies if symptoms are severe. Your doctor might recommend alpha blockers to relax prostate muscles, or 5-alpha reductase inhibitors to shrink the gland. These work better when combined with dietary changes. Think of it this way. Medication manages symptoms today. Diet prevents worsening tomorrow. Together, they give you the best outcome. One patient combined tamsulosin with the dietary changes we discussed. His symptom score dropped 60% in 3 months. But there's one more thing that amplifies results even further. Exercise, specifically cardiovascular exercise and pelvic floor work. A 2015 study from Harvard analyzed physical activity levels in men with BPH. Men who exercised vigorously at least 3 hours weekly had 25% lower risk of severe urinary symptoms. Here's the mechanism. Exercise reduces systemic inflammation. It improves blood flow to the prostate. It helps maintain healthy body weight, which reduces pressure on the bladder. Now here's what works best. Brisk walking 30 minutes daily. Swimming. Cycling with a proper seat that doesn't compress the prostate. Strength training twice weekly. But avoid exercises that put excessive pressure on the pelvic floor, like heavy squats or deadlifts with poor form. One patient started daily walks and basic bodyweight exercises. His urgency improved and he lost 15 pounds. Both factors helped his symptoms significantly. Now physical activity addresses the inflammation side. But there's a specific technique that targets prostate drainage directly. Pelvic floor exercises, also called Kegel exercises. These strengthen the muscles surrounding your prostate and bladder. Research from Italy studied 300 men with BPH doing daily pelvic floor training. After 12 weeks, 68% showed significant improvement in urinary symptoms. Here's why this works. These exercises improve blood circulation to the prostate. They help drain congested fluid. They strengthen bladder control muscles. Here's how to do them correctly. Identify the muscles by stopping urination midstream. That's the feeling. Then when you're not urinating, contract those muscles for 5 seconds. Release for 5 seconds. Repeat 10 times. Do this 3 times daily. Most guys do them in the car, at their desk, before bed. Nobody knows you're doing them. Start seeing improvement within 3 to 4 weeks. One patient combined these exercises with the dietary changes we discussed. His nighttime bathroom trips dropped from 5 times to twice within 8 weeks. Now you have the complete foundation: diet, medical oversight, exercise, and targeted pelvic work. Let me recap what we covered. 3 foods to reduce: red meat, high-fat dairy, and sugar. The 38% increased risk comes from daily consumption, not occasional. Combine dietary changes with medical evaluation, regular exercise, and pelvic floor work. Most men notice measurable improvement within 4 to 8 weeks. Better flow, less urgency, fewer nighttime bathroom trips. But here's the critical point. This information is educational. It's not a replacement for personal medical advice. Talk to your doctor before making significant dietary changes, especially if you're on medication. Your physician needs to monitor your progress and adjust treatment as needed. If this video helped you understand the connection between diet and prostate health, hit that subscribe button. I post new videos every week on men's urological health backed by research and clinical experience. Drop a comment below telling me which food surprised you most. And if you know someone dealing with BPH, share this video. Next week, I'm covering the 5 supplements that actually work for prostate health with clinical evidence. You don't want to miss it.